In this video, we're going to look at the administrative part of the RCGP AKT examination. More importantly, we're going to look at what to revise. It's often an area of the examination that, even though it's a small part, being 10%, people haven't got a clue where to start. So here's a screenshot of what I was, a teaching session that I was doing with my registrars who were just about to sit their AKT, and I thought about what they really need to revise and put it all onto this one big sort of show. But do not worry, I have broken this down into a much simpler format and made it a bit more manageable to actually read, and we will go through each of these elements step by step. So for the basics of occupational medicine, it's going to be split into two areas, because effectively occupational medicine is where the environment affects the individual and also how an individual condition may affect the environment. And this really plays out in a couple of key areas. One, at work, for obvious reasons, which we all know well about, but the others is looking at when you're on a flight, so thinking about aero medicine, and also when you're driving, so all the DVLA rules. The one big part is basic occupational medicine, which includes about your Med 3. So this is your fit notes, or what classically is they're called sick notes. When you can issue them, how you can issue them, for what conditions and how long for. So just start to sort of read around those. It's also worth making sure that you have a vague idea of basic employment laws, so how many hours people can work, what rests they should have, not in great detail, but you need to be aware of this. Also think about parental leave, and also what are reportable occupational health diseases, such as if a typist gets carpal tunnel, that is actually for the employer to report that disease. For driving, you need to have an awareness of what medical conditions, whether it be neurological, psychiatric, ophthalmic, cardiac, diabetes, musculoskeletal conditions that may affect someone's condition to drive. And if they've got a condition, whether it stops them from driving completely, and what reportable sort of diseases are. Thankfully, the DVLA give you really good guidance, and sort of is something that's very, very simply laid out. Aviation medicine as well, so basically someone fit to fly. So going through exactly the same things as we did for DVLA, but make sure that you add in about pregnancy as well, that's a big one, and also thinking about what your obligations are as a clinician to that person, for saying if they're fit to fly or not. The next part is looking at the patient-practice interaction in both ways. So just think how a patient interacts with the practice, and basically think it from when they initially register with the practice. They might want access to their notes, so think about GDPR, how they deal with complaints, and then finally, when they sadly pass away, how you deal with death certification as well. Think of it the other way. How can the practice prove that it's a safe practice? So we're talking about clinical governance, or certainly a chunk of, and also CQC. Then we're going to look at the doctor-patient interaction, not so much in terms of communication skills, but sort of the nuances that may become apparent. So really, with the doctor interacting with the patient, we're thinking about prescriptions and sort of like what the rules about giving prescriptions, certain controlled drugs as well, and then thinking wider, what other clinical roles are out there. Think about your advanced nurse practitioners, your nurse practitioners, your physician's associates. You should be able to have an understanding of what their job role is for a start, to what their training vaguely looks like, okay, so that you can know what they're safe to do and what they're safe not to do. And the other way around is true. So basically, with that patient interacting with the doctor, are they safe? Okay, so think about the GMC duties of a doctor, understand the key principles of the GMC duties of doctor, and how that then feeds into your annual appraisal process on a yearly basis, and then finally the 5-yearly process of the GMC validation. I'll give you a clue, it looks a lot like your portfolio that, if you're a registrar, you'll all know well of. Moving through, we're going to look at the doctor or the clinician interaction with the practice itself. So from the practice interacting with doctors, we think about leadership principles, being aware of some key medical leadership principles that are out there and how that may be adopted by a practice. Likewise, we're going to touch on clinical governance again. And also, lastly, think about different models for medical practice. You may be aware of the partnership model, okay, where a partner will own part of that business, but that's only one model. There are loads out there, and different areas have different benefits for those models. And likewise, there's some overlap here. So we're thinking about how the clinicians working within the practice, GMC registration, that touches again on the duties of the doctor, the appraisal process, and again, areas of clinical governance. So I've mentioned clinical governance several times, and it may be a new concept to someone who's not aware of dealing with the safety of a medical environment. And it's basically proving that the staff are safe, the patients are safe, and the practice is safe when dealing with patients. And it consists of 7 different, what we call pillars of clinical governance. And you can see them here that I've just listed them out. I'm thinking about like clinical effectiveness and research, audit, risk management, education training, patient and public involvement, using information IT, and staffing and staff management. A lot of these areas will be controlled and monitored by the practice manager or the management team. And so when they start pestering you for, say your mandated training, this is why, because that feeds into the clinical governance picture, which will then feed into the CQC picture. The next bit, taking a step back, is your practice working as a group. Okay, at the moment, this is primary care networks, where a series of practices will come together under a single organizational banner and basically try and make the most of being economic at a larger scale. Main thing to look at is think about the additional roles reimbursement scheme, so the ARRS, and there are 12 different roles that are supported. And then taking even a bigger step back, several different PCNs will work together in a large area with hospitals as well to form what are now called integrated care boards. Back in the day, these were called CCGs, but they are different, so just be mindful of that. As part of that, there will be an associated local medical committee, which is normally a small bit, run by GPs for GPs, so that any gripes, complaints can be pushed through to the LMC, and then they are a larger body that can then help interact with secondary care to make things, hopefully, the better. Finally, we're going to look at getting paid. So how is the contracts run? Because if contracts aren't fulfilled, then certain practices aren't going to get the money from it. And being aware of certain different types of contracts, so the GMS contract, the PMS contract, the APMS contract, and who can have them, and how that's sort of instigated in general practice. So I hope you found this useful. This has just been a breakdown of this admin area just to give you a decent framework of what to revise. I've not gone into great detail deliberately, but if you want me to, drop me a comment below and I'm more than happy to do individual videos on the areas with more detail that should give you enough to pass the exam. Again, I've put all of this in my GP VTS AKT revision guide, so gptemplates.co.uk. Find the GP VTS section, scroll down, and then there is a document which has got all of these different areas sort of listed, which I've tried to sort of cover in this sort of pictorial representation that should hopefully help you revise. Hope you found that useful. Please feel free to share this video amongst your colleagues, make sure that they all smash the AKT as well.